Okay, great. Well, thanks very much. I'm going to talk about AI for better outcomes and healthcare experience. And I am the founder and chief AI officer of Adherity, and I'm about to tell you what Adherity does. So there's actually two kind of sort of unrelated problems I'm going to talk about, but they're kind of solved in very similar ways. So one is a mislabeling of healthcare products, which can actually cause major product recalls, but also even result in sickness and death in some cases if you label the product wrong and it's used incorrectly. Another thing I want to talk about is how we can use AI to help underserved populations that aren't getting sufficient health information, how we can get them information in their own setting, so that they, conditions that really should be able to be addressed early on don't get really bad, and that's just bad for everyone. So how can AI help solve these problems? So the first thing I'm going to talk about is using AI to validate current processes and product labels, and this is what Adherity does, where I'm chief AI officer. So what we have is a platform in the middle where you can feed it either like product labels, like literally the label you put on your product. You can feed that in, and also you can feed it product names and then kind of process documents. Our two most popular features right now are the first two, like product labels, like tell me, is this label compliant with various regulations? Because there's a ton of regulations about how you need to give warnings about your product and how you can place it and how you can advertise it and all that kind of stuff. And then also in terms of from the naming point of view, there's actually a lot of regulations as well about how you name your product. Is this product will this name be conducive to getting young people to use your product? If so, you can't do that. So right now, we have a platform where you can feed these into our platform, and you can feed it against a bunch of documents, and those could be regulatory documents, like from the FDA or from your state, whatever state you're involved in, and then it'll automatically produce a number of different things. It'll give you a list of issues. It'll say ding, you're not compliant over here. Your label has this thing and it doesn't say something big enough, so you're not compliant there. And it gives you a justification. It says this is because this regulation says you can't do that. And and this is actually really important, especially in the compliance world. It tells you where I found that information from, the citations. It says this document tells you exactly where it says you can't do that. And then it gives you a number of recommendations on how to fix those. The citations part is really important, and we'll get back to that a little bit later, in that you not only want AI to give you the right answer, but in a lot of spaces, like in compliance is one of them, and in general healthcare is one of them. You need to know where the answer is coming from. And we talked a little bit even in the last session about hallucination. We definitely in this space we definitely don't want to be hallucinating, and we'll talk about how we make sure that doesn't happen. And one of the reasons why this is a problem is that in this space of kind of figuring out, is my product compliant and is my healthcare product, basically safe, human error is very substantial. There's a couple of examples here. In 2022, the number of food items recalled by the FDA increased by 700% compared to the previous year. In January 2023 alone, there were 13 recall events due to kind of labeling deviations. And then there was actually infant formula recalls due to high mislabeling. And in one event, 2 deaths were actually potentially linked to mislabeling. So this is actually potentially a very big deal. So that's why it's an important problem that we're trying to solve. The key elements of our solution is, of course, we're using large language models for image and document understanding. For the product labels, we all know you can feed in a PNG or whatever, and say describe this image, and it'll tell you hey, this is what's in your image. Now, when we get to and I think someone right before our sort of break, someone was talking about using RAG. and I'll talk a little bit more about it, but we use that extensively to search the documents of regulatory and your organization documents, again, to make sure that we're not hallucinating. I'll talk a little bit more detail about that. And then we built like a custom AI agent to kind of put it all together. And some of you, I've read in a few places that 2025 is going to be the year of the AI agent. So, we're building an AI agent basically to help with adherence and compliance. And I'll talk a little bit more about, if you may know all about retrieval augmented generation, or RAG. But we have talked, I've had quite a few people today talk about the gap in between LLM coverage and custom domains like healthcare. Like if you feed, I think what the number was, someone earlier today said there was like 26% coverage of just like the model out of the box of specific healthcare issues. And of course, we know that there's a well-known, anyone that's worked with LLMs knows there's a well-known problem with hallucination. And that's because it's only, the LLMs are so far basically trained on basic data out there on the web, and with kind of limited time frames. Like something that changed yesterday, won't be in there. And your data in your healthcare scenario could be very, very dynamic. So the solution is you basically have what's called a semantic search, and a lot of people use it's called vector RAG. You heard of Pinecone or the systems like that? That's what they do. Search for relevant documents in whatever document set you want to look at. Ping this against the set of FDA regulations or Health Canada regulations or state of California regulations, whatever. And the documents can be either very kind of global, like regulatory documents, or they can be even your own documents. Like, here's a set of policies that we have as an organization. How do we make sure we're compliant with that? And then basically what you say is to the LLM is answer this question, which you can do now, but I'm going to add the part that you can only use the information in these documents, and you better tell me which documents you're using. And you can do that pretty well. So it's kind of a different tuning process. You're not tuning it to see if this LLM knows what the FDA regulation is. You're basically tuning it to find out how well you're going to extract information out of the documents that I'm going to feed you. So that's what Adherity does. Another application that I've been working with another company is using AI to provide patient information. In a lot of underserved communities, patients are not getting the health information they need to better manage their health. So part of what this company that I'm working with called Grapevine Health is doing is proactively reaching out to high-risk patients. And doing a number of things, including kind of providing assistance in getting appointments with their PCP, because we'd rather them go in and see their PCP now than go to the ER in 6 months or a year, because that's not only a lot more expensive, so the provider is actually willing to pay for this, or payers, excuse me, but who wants to go to the ER, right? And we're also, and this is where RAG comes in again, is we're also providing answers to health questions, kind of in the common vernacular. So again, going back to hallucination, if you're providing answers to health questions, they'd better be accurate. When I first started using these LLMs and against this data, some of these queries, and they'd be queries like, how low is too low or too low or high for blood sugar, or what do I do if my feet are swollen, stuff like that. And they generated very, very great sounding answers, but they're completely wrong. A physician would look at that and go like, "Oh my God, this is terrible." So that's where RAG comes in again. And so what we have in our solution is an SMS messaging platform that will proactively reach out to these patients, and then we have a system for managing and delivering content. And that content could be text, it could be video, it could be images. And then again, we're using LLMs for language generation, but we're using RAG to search like a set of curated answers. So we have come up with a set of curated answers to questions like, how low is too low for blood sugar, or what do I do if my feet are swollen, or whatever. And we make sure that the answer that we're providing the patient is kind of compliant with those answers. Another thing we're using AI for is we're experimenting at least with kind of using neural machine translation to try and provide the answers kind of in the, the common vernacular of whatever, population we're addressing. There's a lot in a lot of communities, there's a significant mistrust of the kind of the medical establishment for a lot of very good reasons. So one of the things we're trying to do is see if we can kind of, actually use AI to help by being able to kind of give kind of open-ended and creative free-form responses, but kind of in the kind of common vernacular. And so those are the two things that we're doing to improve patient outcomes. So, any questions?
Yeah, thanks. So let's grab a question or two over here. Raise your hand. I think that was great getting into more of the technical side of how the AI is working under the hood. And just want to say, I appreciate your coming. When we were getting connected and I saw your profile, we just switch back to the thank you screen. And okay, was that you were involved in some of the earliest that I'm aware of, like with speech recognition and
Yep.
text-to-speech, speech-to-text,
Yep.
and I was working on that 20 years ago, and you were as well. So it's crazy how things have finally gotten to where they are. It feels like it took us a long time, and now we're here.
Oh, absolutely.
Thank you. Hey, great talk. I had a question around the concept of pre-generating some of the answers or getting compliant answers,
right,
and then translating them to patients. I feel like it's a really cool idea to be able to turn it to be more personable or more cultural specific to whoever your patient is, right?
Right.
And the common example most everyone talks about is Ann Arbor, Michigan, where a lot of women don't get care because they're from a culture where getting care is not provided to them. So like an app like this seemed like very beneficial. However, one of my questions is, how do you verify and validate or measure that the final translation isn't losing too much of the signal that you're trying to communicate, or potentially, you're leaving out beneficial hallucinations because you're trying to overfit to the answer that you already have?
Right. I mean, on the hallucination side, we're very much, and some folks already have mentioned human in the loop. We're not necessarily doing it. Although we in the beginning we were doing it live. We were actually had humans monitoring the answers that went out to the patients to make sure that it's not accurately kind of portraying the answer. And kind of over time, we realized that if we fed it the right answers, it was good enough that it would be able to do that. And then on the kind of, I think that we also had a question about like when in providing the information in their language, how do we measure that? It's a very kind of app-centered measurement right now. Like we take a look at the engagement, and like one of our theories, and we're still kind of going through data on this, is that if you provide kind of the more kind of common vernacular, you'll get better engagement and more responses in the app. And we're testing that out. So that was our thesis, but one of our theses, but we're testing that out right now.
Charles, thank you. We gotta move along, but hopefully you'll be here for the rest of the afternoon, and people can approach you to dive deeper.